August of 2021, Hurricane Ida made landfall in Louisiana as a Cat 4 hurricane. Like everyone in this room, I'm sure, I like to believe that I'm more than prepared for any disaster I may be faced with. Who else feels that way in this room? Are you prepared? I mean, we are emergency managers after all. It's not like we don't go out there and preach preparedness to everybody. But let me tell you, I was the exception to that. I was not prepared at all. And that day, that particular day that Hurricane Ida made landfall, I went to the EOC. I brought everything that I thought that I needed with me. My ostomy supplies, my infusion supplies, snacks for the day, but the one thing that I did not bring with me was my EpiPen. Having successfully managed my food allergy for the past several years, I had stopped carrying one because I thought that I didn't need it. I'm sure you can see where this story is going. On that particular day, we had a catered meal. It was food that I'd eaten before. I thought it was safe. But as soon as I was done eating, I started experiencing anaphylactic symptoms. I started to get pretty nervous, so I approached the EMTs in the room. This was during COVID, so they had mass quantities of COVID test strips, but basically nothing else. That time I started to panic. I'm sure I was probably trembling, much like I am up here right now speaking to you all. But also, at that time when they started calling an ambulance for me, it had been 5 minutes since they just told all first responders to stand down because the winds and the rain had made it too dangerous to operate. My panic was short-lived because an ambulance showed up almost immediately, but my relief was very short-lived. For reasons I will never understand, and if you work in EMS or healthcare in this room, for reasons I will never understand, they decided to inject epinephrine directly into my medical port, directly into my heart. And if you work in healthcare, you know that the only time that that is appropriate is if somebody is in cardiac arrest and all other options have failed. And most people don't even survive that. I can remember it like it was yesterday. Who's watched Grey's Anatomy in here? Who has taken a CPR class in here? All right, so you know that those over-dramatized scenes where the person getting the AED on them starts flopping around like a dead fish is very much over-exaggerated. In my case, it wasn't. My body, I can remember my body doing that. And at that time, the medic had a hold of my port tubing and ended up jerking it and cracking the back of it. I remember the EMT's look of horror as he realized what his partner had just done. I remember arriving at Our Lady of the Lake Medical Center. They were at the forefront of the pandemic in Louisiana, and every day I watched their chief medical officer on the news saying, "Don't come here. We have no beds and we are short-staffed." I remember the doctor yelling at the paramedic about what she had just done to me. And then I remember being in ICU that night and having them move me to a different room every couple of hours because the roof was not holding on the building, and it started raining in on me all night long. After that, returning home, it wasn't long until I realized that my medical port was no longer functional. You see, we didn't realize that in the ER because at the time the doctor wanted my heart to rest because it had just been through a major trauma. And I do require IV fluids daily, and at that point I realized I could no longer give myself the care that I needed. But I also couldn't fly home to where my parents were because the airport had also been damaged. I couldn't go to the ER, I couldn't go to urgent care because all of them were full. They were all diverting. Everybody who was a primary care had been pulled and was working on the COVID floors. Coupled with that, I had only just moved to Louisiana, and having been in Missouri and knowing how to deal with tornadoes, I didn't understand that I needed to have cash because I wouldn't be able to buy fuel. And I also didn't know how to get out of a state that the roads were shut down in. So I was stuck in Louisiana for over a week before I was able to return to my home state to get care. And in that time, my condition very much deteriorated. All right, so having been through that experience, it absolutely changed my life forever. You see, I loved response, because who doesn't think response is the most fun sometimes? Living in the chaos is absolutely fun. But at that point, I realized that preparedness is where it's at. Because in today's time, right, where we're having increasingly more severe events at a much faster, alarming rate, preparedness is the only thing that is going to get us through, because we don't have time to restock our supplies between disasters. And so when it comes to the disability community who has more than enough challenges that we face with on a day-to-day basis, like fighting with our insurance and figuring out how to live paycheck to paycheck, the last thing we want to throw in there is having to navigate a recovery without any education. So this brings me to, what can we do as emergency managers? Well, first we need to get to know our communities that we work in, learn our demographics, and there are many, many great tools to do that, such as the HHS Empower data, census data, but there's also a great tool that FEMA has. Shout out to Benjamin Rance in the back. He will be presenting tomorrow. FEMA has this great free tool called the Resilience Analysis and Planning Tool. And it takes all of those different resources that are publicly available and puts them there, and you can look at different layers. Want to know how many hospital beds your community has? You can find that on Wrapped. Want to know what medical specialties they have? You can find that on Wrapped. Because in Louisiana, we have a lot of hospitals, but most of them are only doing mental health care. You can't send a patient there. But you can find all of that information on Wrapped. Second, get to know the disability partners in your community. Learn who they serve, what resources they have. Some of them may have warehouses that you can share space with. They have supplies that they can bring to help people who have lost theirs. And third, use those community partners and the data you have to get down on the community level and meet the people with the disabilities in your community. I deployed to New Mexico, and I worked at Gallup Indian Medical Center during COVID. And I was so excited one day, they brought an ostomy patient in. And I was like, oh my gosh, I'm gonna go meet this patient, I'm gonna work with them, and they're gonna be just like me. She had no idea how to take care of her ostomy. Didn't even know how to change her own bag. Because patient education is a privilege and not a right in this country. Once you get to know these people and you start integrating them into your planning, whether you start a coalition, you work with the Governor's Office of Access and Functional Needs, exercises, work with them on integrating them fully into your plans. If you've met one person with a disability, you've only met one person with a disability. In this country, we have 26% of adults that live with a disability, and this number is only increasing due to more chronic conditions and an aging population. 24% of them also live paycheck to paycheck or on a fixed income. This limits their access to mitigation, evacuation, insurance, and all other forms of recovery. That being said, the time to include is now. Thank you.